student. Our next topic on the Explain Why series is why carotid body is insensitive to anemic hypoxia. As we all know from our previous knowledge that carotid body is a peripheral chemoreceptor. It is located at the or close to the bifurcation of common carotid artery. Here we can see this minute small carotid body which is actually a chemoreceptor located near the bifurcation of common carotid artery. Carotid body is composed of type 1 and type 2 cells. So these are the type 1 cells and type 2 cells. Type 1 cells are also known as glomus cells. These cells are oxygen sensitive, whereas type 2 cells are mostly the anchor cells. Type 1 glomus cell have oxygen sensitive potassium channel, and conductance of the channel, it is reduced in proportion to the degree of hypoxia to which it is exposed. That means more and more hypoxia or lack of partial pressure of oxygen, less will be the conductance of potassium efflux. So potassium will not go out, so it will be accumulated inside the cell, causing depolarization of the cell. And this depolarization will cause opening of voltage gated calcium channel, primarily the L type of calcium channel. And through this channel, the calcium influx will occur. This will trigger action potential and release of neurotransmitter dopamine. This excites the afferent nerve fiber ending of the glossopharyngeal nerve, and these ultimately connect with the central respiratory centers and stimulate respiration in response to hypoxia. So in a nutshell, we can say that carotid body is a chemoreceptor. Chemo means it receives the signals like chemical signals like PO2, PCO2, pH. For example, baroreceptor receives the signal of pressure, barometer, pressure. Similarly, chemoreceptor receives the signal of chemical changes like partial pressure of oxygen. So when there is reduction in PO2 or hypoxia, there will be oxygen sensitive potassium channels will be closed or their conductance will be reduced. That will reduce the potassium exit from the cell, which will cause the depolarization, and that will cause the opening of voltage gated calcium channel, calcium entry, release or exocytosis of dopamine, and that will stimulate the afferent glossopharyngeal nerve, which will communicate with the central respiratory center and stimulate respiration in response to hypoxia. Know what is carotid body, where it is located, how they are getting stimulated. Now the question is that it is stimulated by hypoxia except anemic hypoxia. So why anemic hypoxia will not be able to stimulate the carotid body? That is our point of interest. So from this figure we can see the size of the carotid body, it is very small. It is only 2 milligram, whereas it has enormous blood supply. Around 2 liter or 2000 ml of blood per 100 gram tissue per minute is supplied to this tiny carotid body. If we compare the blood supply with other organs, you will see that liver is a large organ with mass of 2.6 kg, but its blood flow is 57.7 ml per 100 gram tissue per minute. Kidney, its mass is 0.3 kg. It is getting 420 ml per 100 gram tissue per minute. Brain, one of the most vital organ 1.4 kg is the weight, getting 54 ml blood per 100 gram tissue per minute. So you can easily compare that a tiny 2 milligram carotid body is getting 2000 ml or 2 liter of blood per 100 gram tissue per minute. So we can say that blood flow per unit tissue is so much high in this carotid body. The amount of oxygen needs of the cells will usually it is made by the dissolved oxygen alone. So dissolved oxygen in the blood is adequate to combat the demand of the carotid body cells. So we know oxygen is carried mainly in two forms. One is the dissolved form and mostly in the oxyhemoglobin form. Dissolved form is very less, only 3%. So these 3% dissolved oxygen is adequate to fulfill the demand of this tiny carotid body because they have enormous blood supply. What happens in anemic hypoxia? If you look into the different types of anemia, hypoxia like hypoxic, anemic, stagnant, histotoxic, in anemic hypoxia, actual defect is the hemoglobin level is less, but the arterial partial pressure of oxygen concentration is normal in case of anemic hypoxia. So as the arterial oxygen tension is normal, so the dissolved oxygen content is also normal. Even though we can say that the combined oxygen in blood is remarkably reduced in case of anemic hypoxia, but as the dissolved oxygen content is adequate, so these will adequately fulfill the demand of the carotid bodies. So they will not suffer from any kind of hypoxia and will not be stimulated. Explains why carotid body is insensitive to anemic hypoxia. Thank you and subscribe.